Good morning, members. Today, my presentation will be on the topic Security Assessment of Transformative Health System. Security Risk Assessment Tool or SRA tool. The SRA tool is free and enables us to painlessly conduct our own risk analysis in accordance with the requirements of the HIPAA security rule. A security risk analysis is the foundation upon which to build the security activities in order to protect EPHI. The SRA tool further will help us to identify and assess the risks to EPHI in our practice so that we can implement the required safeguards. Administrative applications are used to collect, store, and report patient demographic information. It is also used to manage schedules, admit, discharge, and transfer patients, creating insurance claims, and to handle manual billing or electronic billing. Some of the administrative applications of THS are as follows: Patient Portal, Registration System, Payroll and Human Service Systems, Customer Relation Management (CRM), Scheduling Systems, or IDS. Talking about clinical applications. Clinical applications provides interface between provider, consumers, and pharmacy, making the communication channel more easy and convenient. With the help of clinical applications, the overall data can be easily viewed and retrieved on the end user side. Further, talking about clinical applications that are adapted on THS, we can see Clinical Data Repository, Clinical Access Portal, Health Information Exchange, that will be HIE, My Patient Portal, or e-prescribing on both ambulatory or on the precise medicine side. The overall goal of both administrative and clinical applications will uniquely connect the patient, physician, and the community to the key information that will improve their health and make access to the healthcare stress-free and more convenient. Making the integrated health data, PHI and EHR, collaborated to each other, which can be easily accessed by any applications through the DBMS server, will be our ultimate goal. And in order to achieve that goal, there should be some security considerations that is further described here. Having security in internet communication with either SSL or TLS will provide more security internet communication standards. Similarly, having security in authentication, that may be multi-factor authentication, so that unauthorized users will be kicked out of the system. Also, security considerations such as having the data management in cloud or having data backup in different options so that the main server cannot be attacked by any malwares. That can be another option. Similarly, the security considerations, we need to be very thoughtful of HIPAA protection and also training all our users and our internal clients along with the management protocols and access control systems. And lastly, having considerations along with security in our network and Wi-Fi network, along with following all the IT regulations and the standard formats will be very, very vital in our organization. As we all are aware that THS is planning on using home-based biometric devices and integrating it into the organization internal network so that online visits and data can be carried out through the patient portal without having the patients to visit a physician's office. With all the current situation of pandemic, this may be one of the blooming solution as patients don't need to rely on visiting physician's office physically, and the data can be integrated into the overall server by virtual visits. The home-based devices such as network thermometers, glucometers, and blood pressure monitors rely on the data and is authenticated from the consumers. As we can see, depending on the authentication factor and the user, the data can be easily manipulated through the wrong intentions. As we can see, the data can be partially faked, or even it can be tricked easily, or may not recognize the voice of a sick patient, or unauthorized use of digital wallet. Having all this data manipulation, it can also create an entry point for hackers to loop into the organizational internal network that can cause the hackers attacking the IP of the server, causing serious damage to overall PHI data. As a result, before implementing the home-based biometric devices and integrating it into the company's internal network, it is necessary to review the IT standards, data backup policies, and creating risk mitigation before the overall implementation of home-based biometric devices into the company's internal network. Thank you everyone for your time and patience. Thank you once again, and please do let me know if you encounter any questions.